Hi, it's Dr. Lindner again. In this video, we're going to take a look at the upper extremity and some of the major landmarks that we've seen pop up on the Connect lab. So here in this view, we are looking at the scapula and the humerus, and we can see a little bit of the ulna. Okay, so when we look at the scapula, this portion here is the medial border, also known as the vertebral border because it's closer to the spine. This is the lateral border or the axillary border. And then up here is the superior border. Then there's a superior angle, an inferior angle, and a lateral angle. This is the spine of the scapula, and an extension of the spine of the scapula takes us to the acromion process, which is kind of like the highest part of the shoulder. We do have some fossas here. So the fossa above the spine of the scapula is the supraspinous fossa. Below it is the infraspinous fossa. And then you have the glenoid fossa or the glenoid fossa or the glenoid cavity. The glenoid fossa or the glenoid cavity is the depression for the head of the humerus to articulate with. Then there's a greater tubercle. On the anterior side, we'd be able to see the lesser tubercle. Here's the humerus, and here's the ulna. This part of the humerus is the medial epicondyle. On the opposite side would be the lateral epicondyle. This is the olecranon process of the ulna. So here's the humerus. We're looking at the forearm, and we're looking at the hand. So on the thumb side is where the radius is. Remember, the thumb radiates out. The thumb radiates out. So this is the radius, this is the ulna. Also notice that the ulna really clasps the humerus. The radius does not. It does have an articulation, but here's the head of the radius. It doesn't clasp around the humerus like this olecranon process does of the ulna. In the hand, we have 8 carpals. We have 5 metacarpals. And then we have 14 phalanges. When we look at the scapula from a different perspective, here is again, the difference between the posterior scapula and the anterior scapula. The anterior scapula is smooth. We have this large fossa called the subscapular fossa. But on the posterior side, you can see the spine of the scapula and the acromion process. The spine of the scapula is a key landmark because it delineates the supraspinous fossa from the infraspinous fossa. Supraspinous fossa is where the supraspinatus muscle originates, and the infraspinous fossa is where the infraspinatus muscle originates. The subscapularis or subscapular fossa is where the subscapularis muscle originates. These are 3 of the 4 rotator cuff muscles. The 4 rotator cuff muscles are SITS, S-I-T-S, supraspinatus, infraspinatus, teres minor, and subscapularis. These 3 fossas are origins of 3 muscles: supraspinatus, infraspinatus, subscapularis. This is the supraspinous fossa, infraspinous fossa, subscapular fossa. The 4th fossa is here, which is known as the glenoid fossa or glenoid cavity. Way at the bottom is the inferior angle, superior angle. From this view, inferior angle, superior angle would be up here. Here's the glenoid cavity. There's a supraglenoid tubercle and an infraglenoid tubercle. Here's the acromion process, and here's the coracoid process. Now, don't confuse coracoid process with the coronoid process of the mandible, but there's also a coronoid process of the ulna. Okay, so remember the scapula has the coracoid. The coracoid is on the scapula. That's how you can remember it. Okay, so let's look at the borders: superior border, medial border, lateral border, superior angle, inferior angle. Notice the subscapular fossa is smooth. This is, we know we're looking at it from the anterior view. Here is the acromion process with the coracoid process. Lots of muscles attached to the coracoid process. We're going to have the short head of the biceps attached here, the coracobrachialis attached here, and even pec minor attached here. So learning osteology is really important because the bones are landmarks for where muscles will either originate or insert. That's why osteology is so important. The other name for medial border is vertebral border, and the other name for lateral border is the axillary border. Here's the glenoid cavity. Here's the infraglenoid tubercle, supraglenoid tubercle, coracoid process, acromion process. Okay, here again is the subscapular fossa, infraglenoid tubercle, glenoid cavity, coracoid process, and acromion process. Here's a notch, the suprascapular notch. Remember, supra means above. Now we're looking at the clavicle. Part of the clavicle is going to articulate with the acromion process, and then the other end of the clavicle is going to articulate with the sternum, specifically the manubrium. So the flatter portion, the wider, flatter portion here is known as the acromion end. The sternal end is more round. Okay. Now we have the blue bone here. Right here is the clavicle, and you can see the clavicle articulates with the manubrium, the sternum, and then you have the acromion process. So here's the acromial end. Here is the coracoid process. Here is the subscapular fossa of the scapula. You can see the ribs. Here's the humerus. Here is the great tubercle of the humerus. Here's the lesser tubercle of the humerus. And then here is the intertubercular groove, also known as the bicipital groove, which is where the long head of the biceps travels through. And we move down the humerus. Here's the medial epicondyle and the lateral epicondyle of the humerus. The medial epicondyle is that knobby prominent portion on the inside of your elbow. It's an important landmark because it's where all of the wrist flexors originate. So if you flex the wrist and flex your fingers right here, you'll see all these muscles here start to move when you flex the fingers and flex the wrist. So all these muscles here originate off of the medial epicondyle. When there's pain and tenderness and sensitivity here, we call it medial epicondylitis, aka Alfred's elbow. On the lateral epicondyle side, that's where all of your wrist extensors originate. So when you extend your wrist and you wiggle and extend your fingers, all the belly of the muscles along the lateral epicondyle of the humerus start to move now. Okay. So anyway, this is the humerus. You can also see that in the humerus, there's a little fossa here and a little fossa here. Here's the ulna, here's the radius. This part of the ulna is called the coronoid process. So the coronoid process fits in the coronoid fossa when the elbow flexes. Again, the coronoid process will fit in the coronoid fossa, extreme elbow flexion. The head of the radius will fit in the radial fossa on extreme flexion. The head of the radius fits the radial fossa on extreme elbow flexion. Okay, so here we're looking at the anterior view humerus. This would be the lesser tubercle, and over here is the greater tubercle. Greater tubercle, lesser tubercle, intertubercular groove, aka bicipital groove. Here is the anterior view of the distal humerus, that's the medial epicondyle, lateral epicondyle, Since this is the lateral epicondyle, this is where the radial bone would articulate with. This is where the ulnar bone would articulate, since it's more medial. This depression is the radial fossa. Depression is the coronoid fossa. This is the capitulum. This is the trochlear. Capitulum articulates with the head of the radius. Trochlear articulates with the trochlear notch, the ulna. This depression on the posterior view of the distal ulna is called the olecranon fossa. The olecranon fossa is for the olecranon process, the ulna. So now we're looking at the radial bone and the ulnar bone. Here is that coronoid process I mentioned before. Here's the radius. This is the radial tuberosity. Here is the ulnar tuberosity. At the distal end is the xyloid process of the ulna. Here's the head of the radius. Here's the radial tuberosity. And at the distal end is the radial xyloid. This radial tuberosity, this is where the biceps brachii will insert. Here is your olecranon process. When you lean on your elbow, this is what you're leaning on. The olecranon process is on the posterior. The coronoid process is on the anterior. This is the trochlear notch. This trochlear notch is going to fit perfectly right here on the trochlear. Here's the capitulum. The capitulum is going to articulate here at the head of the radius. And it's that articulation between the head radius and the capitulum that allows your hand, your forearm, to rotate. That rotation is what we call supination, pronation. Supination, pronation. It's the junction between the ulna that allows for that hinge joint, allows for flexion extension. So here's that close-up view of elbow. Here's the medial epicondyle. Here's the lateral epicondyle. Here's the radius articulating with the capitulum. Here is the coronoid process, the ulna. Here is the trochlear. Here's the radial fossa. Here's the coronoid fossa. Radius, ulna. Here's the radial tuberosity, which is where the biceps brachii will insert. Here's the head of the radius. It's round that articulates the capitulum for supination and pronation, whereas the ulna is going to create a hinge joint articulated with the distal end humerus to allow flexion and extension. So here's that full articulation of the radius with the humerus, the ulnar humerus. This is the humeroradial joint. This is the humeroulnar joint. At the distal end of the radius, the head of the radius, proximally, here's the styloid process of the radius distally. Styloid process of the radius. Now, when we look at the carpal bones, there are going to be 8 bones. They're going to be in 2 rows. So we have 1, 2, 1, 2, 3, 4. Again, distal row 1, 2, 3, 4. Proximal row 5, 6, 7, 8. So little silly mnemonic, remember them, from lateral to medial, proximal row first, then distal row second. Silly mnemonic. Again, I didn't come up with it. It's been out there for years and years and years, but here it is. Some lovers try positions that they can't handle. Again, some lovers try positions that they can't handle. And I'm sure when we're talking about positions, it's probably or Tai Chi, something like that. Okay, so the bones. Some lovers try positions. The first letter of each: scaphoid, lunate, triquetrum, piriform. That they can't handle, trapezium, trapezoid, capitate, hamate. Okay, those are 8 carpal bones. So trapezium, trapezoid. So that would be the trapezoid. The capitate is in alignment with the 3rd digit. Okay, so this is digit 1, 2, 3, 4, 5. So what's this? It's highlighted. Some lowest tried positions that they can't handle, can't capitate. It's the largest. This one here is the scaphoid. It's the one most commonly fractures when you fall an outstretched hand, and there's pain in the anatomical snuff box. It's usually a fracture of the scaphoid. Okay, so we have carpals. Again, 2 rows, proximal row, distal row. Then we have metacarpals. Meta means after in Greek. So you have carpals, metacarpals. Then we have phalanges. So these in blue are phalanges. But which one? We see some choices: proximal, middle, and distal. So these are proximal, middle are here, and distal are here. Thumb is unique. The thumb does not have middle phalange. The thumb is a proximal and a distal phalange only. There is no middle phalange. These joints here are the metacarpal phalange joints. MCP, metacarpal phalange. Okay, so they want to know, what is this highlighted? Which metacarpal is it? Thumb is digit 1. This is 2. The middle digit is 3, 4. The pinky is 5. So this is metacarpal 3. So we'll stop here, and then we will start the lower extremity.